Hi, welcome to my YouTube channel. My name is Sarah Peternell. I'm the owner of Family Nutrition Services in Denver, Colorado, but I work with people all over the United States and all over the world. So thanks for finding my channel, and today I'm answering a question that I seem to get a lot from viewers and subscribers. So I wanted to address, I think, a common concern that a lot of people have when they're first diagnosed with Hashimoto's. The question is, how serious is this disease? And can it be fatal? That's kind of a scary thought. If you're new to my channel, I do lots of videos about Hashimoto's. I have Hashimoto's. It's in remission, thankfully due to diet, proper supplementation, and lifestyle measures that I've been implementing over the past 20 years or so. I know when I was first diagnosed with Hashimoto's, I was scared too because I was told, here's a medication that you have to take for the rest of your life. I was just in my early 20s, and that kind of seemed like a death sentence. If I don't take this medicine, what's going to happen to me? So a lot of people, newly diagnosed or people who have been having some problems getting their Hashimoto's under control, probably start to worry and wonder if the seriousness of their condition could be fatal or could have majorly life-altering, circumstances. And it is true that this disease is life-altering in many ways. If you've been watching my videos for a while, you know that some of the life-altering things are that you may have to change your diet in order to reduce the autoimmune attack against your thyroid. It can be life-altering in that you are probably going to have to get control of your stress. And it can be life-altering in that you can actually live happier and healthier than you ever thought possible. But let's address some of these top serious concerns that are related to your first conversation around Hashimoto's. I'm so glad you found my channel. Let's get started. So I have actually talked to some of my fellow practitioners, favorite endocrinologists, primary care doctors, and I've asked this question. Is Hashimoto's disease potentially fatal? And this is their reply. Yes, Hashimoto's can be fatal if it is left untreated. That's the key word. You have to treat Hashimoto's. You have to work closely with your doctor for proper medication when it is warranted. If your lab work and your symptoms and your condition is consistent with the need for levothyroxine or any variation of T4 and T3 medications, then you must take it. This is where doctors have the biggest concern, is that a lot of their patients say they're going to do things naturally. I'm all for it, but it's a partnership. It's a partnership between taking your medication according to your doctor's instructions and also working with someone like me to help round out the equation of understanding exactly what you can do with food, supplements, lifestyle, stress management, exercise, sleep, body, mind, spirit, the whole thing, right? I'm an advocate for taking your medicine properly. I do have clients who've come to me and they're trying to manage it themselves without medication and they don't feel very good. And the first thing I always say is, when's the last time you saw your doctor? Are you taking your medication properly? And if you're not, why not? Let's start to get some things under control by first circling back with the basics, which is to get a full thyroid panel, your antibodies tested or retested, and to also understand what medication can do to start to bring your body back into homeostasis. Your body needs thyroid hormone. Without treatment, a person who spirals into hypothyroidism runs the risk of heart issues. I've had heart issues. It's scary. I know how terrifying this can be. My heart issue wasn't because I wasn't taking medication. Separate issue. But I know that we don't want to mess around with something like our most precious heart. And also left untreated, hypothyroidism can lead to extreme hypothyroidism that may result in a coma. This is pretty serious stuff. So there are some risk factors, of course, for why Hashimoto's may be more serious of a condition. These risk factors include if you are a woman. Women are 10 to 15 times more likely than men to develop Hashimoto's. So women, you need to be aware of the signs and symptoms of hypothyroidism. You need to stay on top of your doctors to make sure that they're checking your thyroid, maybe at every single annual exam or at least every few years, especially if you feel tired or if you are having a hard time regulating your body temperature, you feel cold all the time, if you're losing hair, if your skin is dry, if your nails are brittle, or if you're gaining weight rapidly and you don't know why. You demand answers of your doctor and you require that you get the proper testing done because women are at a greater risk of hypothyroidism and Hashimoto's. And 90% of the time, hypothyroidism is Hashimoto's, which is the autoimmune attack against the thyroid. Also, if you have a family history, so you probably know if your mom or your sister, your aunt, your grandma, someone in your family has Hashimoto's, then you also may be at a greater risk. So share these risk factors with your doctor. You know, my mom has Hashimoto's. Is this something I should be getting screened for? Definitely. People who develop Hashimoto's generally have one family member with Hashimoto's. I'm adopted, so I don't know, but I'm keeping a close eye on my own kids, especially my daughter, as she hits puberty and into young adulthood to make sure that we're doing early screening. It's very important. Also, any individual who has excessively high or excessively low intake of the mineral iodine may be at a greater risk or a higher prevalence of thyroiditis. Now, I'm not going to go into all this. You can watch my other video about iodine if you want to learn more about that particular mineral. But what I will say is that this important mineral helps to regulate the thyroid, helps to produce thyroid hormones. And so if you're consuming too much or not getting any at all, then you may have problems with your thyroid. In our country, it's actually pretty easy to be eating a very iodine deficient diet. If you're eating the standard American diet of fast food, processed food, junk food, Franken food, alcohol, soda, not drinking enough water, and consuming a lot of sugar, this is typically an iodine deficient diet. So if you are eating a low nutrient density diet, then it's a pretty good sign that you probably have low iodine. And if you're here because you both consume maybe a poor diet and you just got a diagnosis of Hashimoto's, the good news is diet can help with that. Watch some of my other videos about the important nutrients that you should start to bring in to your individualized plan, or you can work with me. The last big risk factor for Hashimoto's is if you've had radiation exposure. The likelihood of developing autoantibodies against the thyroid gland goes up with our sort of exposures. You know, when you go to the dentist and they are going to take an x-ray and they put that big, heavy, like blanket over top of your neck and chest, it's because they don't want to expose your thyroid to the radiation that is present with the x-ray. So pay attention. What's going on in your environment? Are there poor dietary factors? Are there toxins? Are there pathogens? You can watch some of my other videos about root causes, but these particular risk factors that I've outlined in this video today should give you a pretty good idea if you need to be overly concerned about the outcome and prognosis when you receive your Hashimoto's diagnosis. For most people, it's a bummer. And it can be a little defeating at first. You might feel like, oh gosh, I'm just so tired and my brain fog's really getting the best of me and I've gained 20 pounds. I feel like just throwing in the towel, but don't. take your medicine properly, have regular visits with your doctor, and work with someone who's board certified in holistic nutrition and understands Hashimoto's, an autoimmune disease, healing the gut, addressing underlying root causes, and really helping you to customize the best individualized nutrition plan that will help you to overcome Hashimoto's. There are some complications, as I said, that can come along with Hashimoto's. So let me explain a few of those, just in case you're dealing with some of these in your own personal medical history. A goiter. A goiter is really the state of the thyroid when it starts to become enlarged. So it's a little different from a thyroid nodule. I'll talk about that in a second too. But a goiter is that the entire gland is enlarging. It is inflamed. It may be undergoing the autoimmune or antibody attack and is at risk of being destroyed. So a goiter, while both kind of aesthetically not that nice, right? A lot of women and men who are having goiter are very aware that their thyroid is swollen because they can actually see it in the front of their neck. It might create some discomfort, and it can also be unpleasant in terms of other musculature and tissue in this area. It can feel quite congested. Your voice can feel kind of hoarse. It can be harder to swallow, and it might just feel kind of ugly. So if you are dealing with a goiter, that is because your thyroid gland, the whole thing, is enlarged. Now, a thyroid nodule also may be a part of what your diagnosis includes. And these types of things usually are found in an ultrasound of your thyroid. So they use the ultrasound wand with their little warm jelly over your neck to look to see what is the pathology of the tissue, what is going on, where are the areas of blood flow, where are some areas of damage, where are areas of inflammation, and what is it creating. So a thyroid nodule is where part of the gland is enlarged. Okay. So the second complication, I did talk a few minutes ago about heart issues. Well, cardiac complications are obviously the most serious side effect of leaving Hashimoto's untreated. But on the other side of things, hypothyroidism can affect the heart. It can cause changes in contraction and rhythm that may lead to things like heart failure or a heart attack, or it may lead to other indirect influences such as having high cholesterol, or maybe even risk factors for stroke. So just because you don't have heart failure, or just because you don't have ultimately the worst outcome, death, with cardiac issues, being aware that these serious problems may accompany your diagnosis. And in my experience, working with many of my clients, a lot of women actually start their journey to understanding that they have Hashimoto's and getting proper diagnosis because they felt that they might actually be having a heart attack. And so upon going to urgent care or an emergency room or to see their primary care doctor with these symptoms, a host of tests have basically narrowed it down to hypothyroidism as being at the root cause of their cardiac issues. So the third complication that I think is most common and also most commonly ignored or just sort of written off in a lot of cases with allopathic medicine is that mood changes, behavioral changes, mental health changes definitely accompany Hashimoto's. And you can watch some of my other videos about anxiety and mood, because it is very common, again, women and men going to their doctors and saying, I just don't feel like myself. I don't have a reason to be depressed. I don't think I'm feeling anxious, but physically something is wrong. And especially if you're dealing with that kind of chronic fatigue, brain fog, and just overall malaise and not feeling well, you're definitely starting to feel depressed as well. It is true that underlying depression exists in a lot of cases, and Hashimoto's may worsen this condition. So pay attention. Don't just chalk it up to the world we live in. Don't just chalk it up to the life that you live. If you feel unusually depressed or anxious, this is another reason to go visit your doctor, just to make sure everything checks out. Get some lab tests and take a look at your thyroid. You deserve it. When I was first diagnosed with Hashimoto's, my doctor said, "You're just depressed, and all you need is an antidepressant. And, by the way, you have Hashimoto's." That came a little bit later. Once I started treatment for Hashimoto's, eating better, and taking care of my life, empowered in my own hands, that depression went away. So I would like to leave you on hopefully a very positive note, which is that yes, Hashimoto's is serious, but you can do this. Hashimoto's affects millions and millions of people. It is becoming so common, and it is, in fact, one of the most common autoimmune diseases. Hashimoto's is defined as hypothyroidism because of the positive autoantibodies against your thyroid. It means that your own immune system is confused, and your own immune system is attacking your thyroid tissue because it is miswired. It's wonky. You've heard me say that before. We can rewire and rewrite your story. We can fix these issues through proper treatment, seeing your doctor, getting tested, taking your medication, and also understanding what are the dietary principles, what are the lifestyle practices, what proper supplements are going to help you to feel your best again. I have so many videos here. I'm so glad that you are learning about your Hashimoto's diagnosis from someone who has Hashimoto's and also a Hashimoto's expert. I've worked with hundreds and hundreds and hundreds, if not thousands, of people around the world to help them with their Hashimoto's. And they're all doing really well. Not everyone's going to go into remission, but you can get your medicine right. You can have a great communication and relationship with your doctor to track and monitor symptoms. And you can work with me to eat better, to live your best life. And you know what? Hashimoto's won't be an issue. So, do you want to make a free phone consultation? Sign up on my website. You can do that directly from my YouTube channel up in the corner. Just click book a free phone consultation or go to sarahpeternell.com. Also on my website, I have a free download that you can get for the next time you go to visit your doctor. It's called the Hashimoto's Checklist, and it's a great resource. It's been downloaded thousands and thousands of times. And it encourages me that people are feeling empowered to take this tool with them to the doctor's office and to ask the right questions. And doctors are getting more in tune with how to individually treat their patients who have Hashimoto's. And in fact, more and more doctors are saying, yeah, go meet with a nutritionist. So I look forward to working with you. Thanks for finding my channel. Thank you so much for watching today's video, and I will be back soon with more information just for you. Subscribe, like, share, set your notifications. Bye.